America's relationship with drug addiction has been a controversial topic for as long as drug addiction has been prevalent in the country. America's prohibition of illegal substances is sensible, to be certain, but raises some questions when the country is simultaneously handing out opioids at an unprecedented rate. In 2019 alone, opioids were responsible for 49,860 overdose deaths, which makes up more than 70% of all recorded deaths from overdose, according to ASPA. Even more shocking is that around 40% of those deaths can be attributed to a prescribed opioid, according to ASPA. It's clear that the way America is handling prescription opioids isn't working, and there is some need for reform. The first warning sign that a change is needed is seen in the trends of opioid use and misuse over the last several years. One of the most concerning statistics on this issue is that prescription methadone, hydrocodone, oxycodone, morphine, and fentanyl overdose deaths are consistently increasing annually, according to Logan. This is in part due to the rate of prescription of these substances, which is increasing in prevalence. As a result of this, opioid overdose has unfortunately taken over 81,000 lives from May 2019 to June 2020, according to Davis. The opioid epidemic's roots don't exclusively lie in excessive prescription, however. It can also be argued that there is a severe lack in America when it comes to proper, comprehensive rehabilitative care. An unfortunate aspect of the American approach to addiction is that many people who suffer from opioid addiction find themselves in drug court, which has a much heavier focus on criminally punitive measures rather than rehabilitative care, according to Bowers. This means that many people who find themselves in active addiction are dissuaded from seeking proper care for their addiction, because of their fear of punishment. Additionally, methadone, which is typically used as a substitute for opioids so that addicts could gradually wean off, is much harder to access than it needs to be. It is heavily regulated and only available at select clinics, which are typically extremely busy, according to Davis. This further dissuades addicts from seeking help for their addictions. It's not only methadone that's arbitrarily regulated, though. Additionally, many harm reduction aids like naloxone, which rapidly reverses the effects of opioid overdose, and fentanyl testing strips, which make sure the product the user is ingesting isn't laced in a dangerous way, are inaccessible to the general public due to heavy regulation, according to Davis. The current level of regulation makes safe opioid use almost impossible for those who find themselves in addiction, and is no doubt responsible in part for the levels of overdose and death seen in recent years. In order to move in the right direction towards a safer economy around opioids, more comprehensive and robust prescription practices must be put in place and practiced in America. Firstly, high daily dosage and long-acting opioids should be more sparingly prescribed, according to Logan. This would prevent addiction being as common as it is now in patients who are prescribed opioids to begin with. To take that point one step further, opioids should be considered a last resort for patients who deal with pain. There are an amplitude of more specific and applicable ways to deal with each case of chronic pain, and while opioids are the easiest, they also have a notable addictive effect that should be avoided if it can be. Unfortunately, however, as of right now, not many people have access to many other methods of pain reduction because of restricted insurance coverage. In order to remedy this, insurance companies should more extensively cover non-medicated methods of dealing with pain, such as acupuncture, according to Davis. Secondly, America needs to move away from the idea of taking punitive measures towards drug addicts, especially the ones American medical systems create. Naloxone, a drug which has no psychoactive value other than to counteract narcotic overdose, should be more easily accessible, as the lives that it would save would be numerous, according to Logan. Additionally, the penalties that drug users face should be reconsidered and shifted further towards rehabilitation, instead of crippling punitive measures that leave drug users with no options of bettering themselves. This would encourage more people suffering through active addiction to seek help and work through their addiction instead of simply avoiding telling the proper authorities about their issues. In a better America in which more comprehensive opioid policy has been implemented, there would be far less families that are subjected to the tragedy and darkness that opioid addiction brings in its wake. In addition to the lives of those with chronic pain being better taken care of, A more conservative approach to the prescription of opioids would also indirectly cut down on the number of opioid resellers that operate in America, as the prevalence of the drugs would be decreased, as well as the general demand for opioids in general. With this collection of knowledge in mind, it's important to make decisions that will help aid the trend towards ending the opioid crisis. This would include actions like going out and voting for politicians that stand behind forward-thinking policy regarding opioids and drug rehabilitation. It's also important to check on the people you care about and make sure they're in good standing, as these addictions are something that may not be obvious externally, and the tragedy of drug overdose is something that can strike at any moment. If, as a national collective, we can look towards a brighter future regarding rehabilitation, we will slowly but surely be able to rise out of the crisis we currently face.